alcohol wipe. Start at the proposed site. Wipe in a circular motion, moving outward with each circle to prepare an area 2 to 3 inches in diameter around the injection site. Let the alcohol dry and discard the wipe into the trash. Insert the needle through the skin at a 45-degree angle so that the tip of the needle is under the skin and above the muscle layer. Gently pull back on the plunger to make sure that the tip of the needle is not in a blood vessel, and then slowly inject the medication. When all the medication is injected, pull the needle out. There's no need to use a Band-Aid unless blood appears at the injection site.
Or the central circulation. The medication diluted in IV carrier fluid mixes with venous blood and is carried along the route of the blood in the veins. A medication administered into the brachial vein of the forearm is carried to the right side of the heart. From there, it is pumped through the lungs and back to the left side of the heart. From the left side, it is pumped through the aorta and into the arterial tree of the body to the upper and lower parts of the body and then to the tissues. Angle through the layers of skin and into the muscle layer. The caregiver ensures that the needle tip is not in a blood vessel. As the plunger is slowly depressed, the medication enters the muscle, forming a bubble at the tip of the needle. Once the needle is withdrawn, the medication remains in the muscle tissue. From there, it is slowly absorbed into the muscle's capillaries.
A microarray patch technology is being developed for the transdermal delivery of large molecule drugs without the use of injections. The patch is in a Band-Aid format, and the surface of the patch is structured with polymer microneedles from which the drug is delivered. The drugs can be attached to the external surface of the polymer microneedles, integrated into the polymer, or both. When the patch is applied, the microneedles cross the stratum corneum and penetrate into the epidermis. The microneedles do not penetrate deep enough to enter blood capillaries or nerves, hence the delivery is non-invasive and pain-free. The drugs for delivery are present in a nanostructured form, facilitating uptake into the body. The microneedles are made of a polymer that is biocompatible and biodegradable. This reduces the risk of trauma to the skin and infection. The microarray patches have been designed for the delivery of peptides, proteins, hormones, vaccines, and skin repair agents. The use of microarray patches will enable a wide range of medications to be effectively delivered to humans in a safe and non-invasive manner.
Absorption refers to the transport of drugs across the membranes of mucosal cells in the gastrointestinal tract. A drug enters the gastrointestinal tract through the mouth and moves into the stomach through the esophagus. Once in the stomach, the drug dissolves. Acidic drugs are absorbed in the stomach because its acidic contents cause the acidic drugs to remain unionized, uncharged, for easy absorption. Alkaline drugs, which cannot be absorbed in the acidic stomach, pass through the pyloric sphincter into the first part of the small intestine and are absorbed there. Once absorbed in the blood, the drug molecules travel through the liver via the portal system. Some drugs are immediately metabolized in the liver. This is called first-pass metabolism. Others may be secreted back into the small intestine in the bile in what is known as enterohepatic cycling. Other parts of the oral dosage may be absorbed in the large intestine or fecally excreted.
Their mouth. The inhalable particles of exubera, which are specifically engineered to allow efficient penetration deep into the lung, first enter the lungs as a dry powder. When the small exubera particles first enter the large bronchial channels, they are still in dry powder form. As the particles travel through the humid bronchial corridors, they rapidly absorb moisture. During passage through the airways, some particles simply dissolve as they collide with the moist walls of the upper bronchial tubes. In the deepest recesses of the respiratory tree, where the bronchioles terminate into millions of tiny alveolar sacs, airspeed lessens. and the exubera particles gently drift into the open chambers. Exubera is specifically engineered for a uniform particle size of 1 to 3 microns to permit efficient penetration into the alveoli, where it is estimated that on average, 1 exubera particle enters a single alveolus. The thin alveolar cells provide an enormous surface area for rapid, efficient insulin absorption. On contact, the particle melts into the thin layer of fluid coating the wall of the alveolar sac. It is believed that the individual insulin molecules penetrate through tight junctions between the cells of the alveolar wall, where they enter capillaries and are rapidly whisked away by the circulatory system to be ultimately carried to muscle cells and other insulin target tissues.
Transfer zat aktif ini menggambarkan bagaimana proses suatu absorpsi zat aktif sampai menghasilkan suatu efek apabila diberikan dengan rute rektal. Berikut adalah gambar yang menunjukkan mekanisme transfer zat aktif, di mana garis berwarna merah menunjukkan transfer zat aktif tidak langsung dan garis berwarna hitam menunjukkan transfer zat aktif secara langsung. Pertama-tama, obat akan masuk ke dalam anus, lalu masuk ke rektum. Di dalam rektum, karena terdapat lapisan-lapisan mukosa dan serabut syaraf, maka akan terjadi proses absorpsi yang berujung di vena mesenterikum inferior atau secara tidak langsung, sehingga dengan adanya aliran darah vena hemorroid tersebut akan masuk ke dalam vena porta dan ke hati yang selanjutnya akan didistribusikan ke seluruh tubuh dan menghasilkan suatu efek. Begitu juga sebaliknya dengan transport secara langsung. Kesimpulannya yaitu yang pertama, faktor anatomi sangat berperan penting untuk mengetahui absorpsi suatu obat. Yang kedua, dapat menjelaskan pemberian obat lewat rektal itu dapat memperbaiki zat aktif yang dapat dirusak oleh hati bila diberikan melewati oral. Yang ketiga, pemberian obat melalui rektal ini lebih cepat menghasilkan suatu efek bila dibandingkan dengan oral karena banyak serabut syaraf.
Ini ilustrasinya. Untuk pemakaian suppositoria dapat dipakai dalam keadaan tidur atau dalam keadaan berdiri.
Buccal cavity. Buccal cavity, generally referred to as oral cavity or mouth cavity, is the beginning of the alimentary tract. The buccal cavity includes tongue and teeth, which are involved in tasting, mastication, and chemical breakdown of food.
Faster, but the question is, why is that? Well, there's actually a very simple explanation, and it starts with what is under your tongue. Well, it's a thin mucous membrane rich in capillaries and blood supply, and you probably haven't looked under your tongue often, but you'll see there actually are a lot of capillaries in there. So what happens is that medication gets absorbed rapidly directly into your bloodstream, and that of course means it's going to take effect.
Straighten your index and middle fingers to extend the head and further restrain the rat. After ensuring that the abdominal area is totally stretched, inject into the lower right quadrant region of the abdomen. Insert the needle at an angle of 30 to 42 degrees into the intraperitoneal region. After ensuring resistance-free insertion of the needle, gently push the piston to deliver the drug in the intraperitoneal region.